Battling and beating cancer. Something unique about having cancer into your family. The issue is how do you deal with it and what do you do about it? Instead of going to Disney World, we heard the word you got cancer, which in my case turned out to be lymphoma. And it's the last thing in the world you expect to hear. I was in my mid-30s feeling relatively good until a few days before.
I just really got mad, and my friend died a year before he was diagnosed, and I just said, you're not taking my husband.
Charlene McMahon Seaman and her husband and the cancer survivor of this relationship, Scott Seaman.
So you didn't know you were clapping, did you? Wow, good morning, everybody. I have to say that we have a fabulous program for you. Welcome to Battling and Beating Cancer. I'm Scott Seaman, and along with Charlene, we welcome you to what really is a special edition, what's going to wind up being the show of shows for follicular lymphoma. This educational symposium is going to feature some of the great minds and hands of lymphoma, research, education. We're dealing with people who are the top researchers, the top clinicians, and I think we know we brought you here on a Saturday, but you're going to get your money's worth. So thank you all for joining us. And how fabulous it is to be at Rush University Cancer Center and to be able to say those words and to be at Rush University Medical Center here at the Cyril Conference Center. Because I know a lot of people over the years whose lives have been saved right here in this institution, and you're looking at probably not the best looking example, but an example of one of them. And it's tremendous to be able to see what's going on, and I'm going to introduce somebody who's really an integral part of that in just a moment. So got home last night and saw, well, we've got a bunch of economic woes, and we've got some instability in different parts of the world, and not much I know or can do about that, but I'm here to tell you that the State of the Union for people who have been diagnosed with follicular lymphoma has never been brighter, has never been better. Their futures will never be longer or more hopeful than they are today. And that didn't happen by accident. It didn't happen overnight. It happened because of a lot of brilliant people, committed people doing a lot of good work, and we all are the beneficiaries of that, and we're going to be the beneficiaries of a lot of new developments that are in designs as well as in practice today, and we're going to be talking about that from some of the great experts. How are you guys feeling today? Well, you're looking damn good, I have to say. How many people have been diagnosed with follicular lymphoma within the past year? All right, so for our radio crowd, quite a few newbies. And how about people diagnosed more than a year ago? All right, so even more veterans. And that's great because you're all going to be veterans and be able to come to conferences like this for the next 75 to 100 years, which is one of the great things about the developments. And I should say, we're also on CAN TV in Chicago, and we are streaming live all over the World Wide Web. And it's sort of amazing. So people are tuning in to ChicagoBloodCancer.org, to RoadToCure.com, and to Betsy's Hope for to Liz's Hope for Lymphoma Facebook page. And the people that we have, that we know about, every spot on the globe, all over the United States, Canada, folks from Australia, from the Netherlands, from Ireland, from Africa, to the Middle East, to the Far East. So a lot of folks and a lot of patients coming together, and how well it is. How many folks are caregivers, loved ones of people? All right, let's give you guys a special round of applause. Because all of us folks with lymphoma, number one, we live for you, but to a large extent, we live because of you. What you do to keep us going is absolutely phenomenal. How many nurses out there today? I want to kiss all of you because every one of us knows there's nothing more important than a good nurse, because you guys give our care. And so there'll be some continuing education as well, so make sure you get those forms before you leave. And for doctors, we're getting this certified, and it's going to go online, and people will be able to get their continuing medical education credits from that. So this program, and you guys are going to live in infamy on the internet. It's going to broadcast about 10 times or more on CAN TV and all over the world through the various websites. So we really thank you for participating. And I have to tell you that this is not just a random selection of the date. Today is World Lymphoma Awareness Day. And so we're all together, and people across the globe, different organizations through the Lymphoma Coalition are doing different projects, everything from making buildings red to educational events to survivor events. And it's something that's really good, but it's not good enough, and I'll talk about that in just a minute. One of the things that we wanted to do was something that goes contrary to my instinct, because I'm a lawyer, so I always think everything's about me. We wanted to make this program about all of you. And so when you registered, we asked everybody, what are the questions you have? What are the issues? Because the leading minds are going to be addressing those, and I think you're going to see that. But we want your interaction, so please feel free to ask questions. All of these doctors, there's not a question you can stump them with. I challenge you to do it. The only thing that we ask is, obviously, because these are great doctors, they're not going to diagnose you in the audience or make specific recommendations. They don't have your history. They haven't examined you, but they'll be able to give you a lot of information. And quite frankly, most of them, including if you want to fly out to see Dr. Romo in Germany, I suspect he'd be willing to see you as well. So we really have a magical crew here today. We're doing a couple things that I don't even know of. A few years ago, if somebody said, I'm going to Google you, I think you could have them arrested. But now we know what that means. We're actually going to be Skyping. I'm not quite sure what that is, but Liz knows. But we're going to be getting questions brought to us, and we're going to bring them up through the panel from everybody who's participating on this globally. And as many people who are here, there will be thousands of people who are right now watching and or listening to us on the internet. So we've got all of these fun things going on, and in addition to the great doctors that we have, I probably could put this better, but your main course for lunch is going to be Betsy DePerry. And Betsy's absolutely phenomenal. She's a survivor. And everybody here, when you turn in your evaluation forms, and you must, because Liz says you must turn those forms in, you'll get a copy of Liz's Adventures in Cancerland book and a copy of Charlene and my book, Battling and Beating Cancer. So couple quick things, and you're doing them all. The numbers the doctors are going to talk about and tell you about how this disease fits in terms of why we think what we do in the world of generating research is so important is because blood cancer research is virtually responsible for all of the major cancer treatments, everything from radiation to chemotherapy, first one in lymphoma, leukemia, monoclonal antibodies, stem cell transplants. So it really transforms not just helping people with blood cancer, but with all forms of cancer. And you're doing all of the things you need to do to survive. You can take a look at that by being here, learning from the best doctors, getting the best treatment for your lymphoma, because even though we're talking about follicular lymphoma, the fine lady in the fourth row, her follicular lymphoma is not the same as the gentleman in the second row. So we're learning a lot, not only about the microbiology, but the treatments, and the doctors are going to be talking about that today. But that's really not enough. What we have to do as survivors and those who love survivors is lead the way to the cure. These doctors can't do it by themselves. We need to help. We need to help by raising awareness, by raising money for research, because that's critical, participation in clinical trials. So in our materials, you'll see a lot of information, but I hope all of you guys will get engaged in whatever activities and to whatever extent you feel comfortable about, because we really can make a difference. This is a superstar lineup of faculty members, and I'm just going to say one quick word about Stephanie Gregory, which is there is none better, and in terms of being a hematologist, oncologist, but also the caring and love that she gives to her patients is phenomenal. So we're going to start out by introducing somebody who's not even a lymphoma doctor, but he's Dr. Howard Kaufman. He's the director of the Rush University Cancer Center. He's a phenomenal doctor. He's a melanoma specialist. He's a specialist in immunology of cancers and tumors. And he's done such a phenomenal job here at Rush and really for all patients. And so, Dr. Howard Kaufman, come on up. Thank you for joining.
So I'm delighted to be here today to welcome all of you to this important session. And on behalf of the Rush University Cancer Center, I want to let you know that we are committed to really understanding lymphoma and finding cures for this disease. I'd like to say a special welcome to our patients here. I don't think there can be a worse thing, a worse day in your life than finding out that you have cancer, whether it's lymphoma or any other kind. What does this mean? What do I do? Do I go to work? Do I not go to work? Do I go see a doctor? Which doctor do I see? What treatments do I have? There's a million questions. The most important thing I think that you can do is to get knowledge and get education. And I think your presence here today is a testament to the fact that you want to do that, and this is the most important thing you can do. And I can tell you that you're going to be hearing from the world's experts in this disease, and I think you're going to leave here armed with the most important thing you can do for battling this disease, and that's to really understand it and know what's available. We've had tremendous progress in cancer. We now can cure probably 70%, maybe a bit more, of all cancers across the board. So this is not a time of no hope. This is a time of extreme hope and enthusiasm in the field. And I think what's happened are a few things. We now talk about personalized medicine, and while yes, we want to take individual care of the patient very well, we know that individual tumors are different. We know the genetics can be different from one patient to the next, and we're now able to study that faster and better than ever before. I was thinking back in the early 1990s, if you wanted to clone a single gene, it would take about 3 to 5 years to do that, not to mention a few $1 million to do that. Today, by next year, probably it'll take 8 hours to do the same thing, and at a cost of probably about $100. So this has really revolutionized the field. So we can study the cells, we can study the genes in an individual patient in a way that makes sense. A little more than what it takes to get a blood count now, we can actually get a genome profile, and that is really revolutionizing the field. We're quickly able to genome sequence an entire tumor cell for patients, and that's actually happened in lymphoma. The other thing that Scott mentioned, which I of course have to say something about, is the role of the immune system. The immune system is critically important, and the reason that it's so important is that when it works, the immune system can cure patients with cancer, and these can be long-term durable responses that we get and can give patients really long-term cures. And so understanding that is critically important. What's changed today is we know that it works. So we have a preventive vaccine for cervical cancer. We have a vaccine in prostate cancer. And last year for melanoma, we approved a drug called ipilimumab, which works through the immune system and is the first drug that's ever showed an overall survival benefit for patients with melanoma. And I have no doubt, and I think you're going to hear about it today, that the same thing can happen in lymphoma. So with that, it is now my real pleasure to be able to introduce the director today, Dr. Stephanie Gregory. And unfortunately, I cannot tell you all the things about her because it would take up the entire day. I think many of you know her and know that in addition to being an outstanding clinician and really a leader in the therapeutic intervention for lymphomas, she is a really, really great teacher. And I have to say that whether I see Dr. Gregory in the hallway briefly or whether we're sitting down at a meeting that has nothing to do with lymphoma, she's always teaching me about lymphoma. And so I have learned quite a bit from her. She is the Elodia Kehm Chair of Hematology and Professor of Medicine in the Division of Hematology and Oncology at Rush University. And she is a great colleague, a great mentor, and a good friend. And I would like to turn this over to Dr. Gregory.
Good morning. It's a pleasure to be here. Thank you. Thank you for coming. The room is full, and we're pleased to see that. I have been privileged to work with tremendous people during my lifetime, colleagues, my physician friends, my lymphoma friends, but mostly my patients and their caregivers, because if it were not for you who were willing to try novel approaches to therapy and to perhaps engage yourself in a clinical trial, we would not be where we are today. We have with us today the top lymphoma doctors in the country. And I don't want you to think that this is just one of the meetings that happens in lymphoma. I'm just looking back over the past summer, and it started with the American Society of Clinical Oncology meeting in Chicago in June, and then many of the physicians in this room went to the European Hematology Association in June, and then in July they were at the Pan-Pacific Lymphoma Conference, and then Dr. Rummel and I were fortunate enough to be in Newport, Rhode Island, where 190 physicians from all over the world came to talk about one of the rarer lymphomas that accounts for only 2% of lymphomas, Waldenstrom's macroglobulinemia. And it was at that meeting that we actually found out that a brand new mutation has been discovered called the MYD88 mutation in Waldenstrom's macroglobulinemia. The next week, it was a lead article in the New England Journal of Medicine by Dr. Steve Treon at the Dana-Farber. We also learned that that mutation activates a pathway known as the NF-kappa B pathway, and we now know that a new pathway inhibitor that you're going to hear about, that our guest speakers have worked on, a pill inhibits that pathway, and it's a very effective agent now with very few side effects. So these are the kinds of advances. Dr. Henry Fung was just at a meeting on T-cell lymphomas with a whole group of nationally known transplanters. There's a meeting this weekend going on in Bologna in Italy on T-cell lymphomas. So